comes out of it, because that's what we want to do. All right. Hey guys, it's Dr. Carter here at Lexington Podiatry, and I've got a cool little abscess for you. I say little, but on a second toe, it's actually pretty big, and we're not sure what started it. Maybe a pedicure, maybe a weird way of trimming it, who knows? Sometimes these things just happen, but it's important to get it taken care of before it becomes a big issue. So let's get started. So here you can see, it looks weird now because of the betadine, but it's this whole area here. It looks like a blister, but the blister was more white, which means it's filled with pus. So we're gonna pop into it before we put the tourniquet on, and we're gonna see what comes out of it, because that's what we wanna do. All right, let's puncture. Ooh, there we go. So you know it's pus when it's thick and purulent and not just clear and thin. So that is an abscess, and it looks like even from here I can push and you can see the skin wrinkling, so I know those things are connected. And if we want to be really gross, I could probably stick an instrument from here and come out the bottom. We're not going to let her see that though. So at this point, we're going to squeeze it and put a tourniquet on it. And then I'm going to check her to make sure she's numb. A minute ago, she could still feel a few things. So we're going to try again. So how about here, my dear?
I just feel you tapping, but it doesn't hurt.
And here?
Same.
That's okay? Perfect.
Tapping.
All right, if you feel anything besides pressure, you let me know. So we decided
That
to...
hurts.
Okay, well see, there you go, she felt it. I'm gonna come back here and put some more in. I'm gonna try to scoot that tourniquet down a bit. Second toes are tiny. All right, so it won't take much, just a little bit of numbing. Whenever we have a pocket of infection, it can always neutralize the chemical or the numbing medicine and make you require more. So that can happen. Okay, so down here she's already numb. We may notice that some fluid starts to come out of that blistered area or the pocket area. Doing okay there?
I can feel it.
She's like, no. And it's almost over. Just a little bit more up here. Kind of turn it around. We're gonna do all of this, and we're not even gonna mess up her pretty purple pedicure. That is perfect for fall. Okay, let's try this again. It's gonna turn all kinds of colors. Okay, sweetie, do you feel that?
Nope.
We're here. That's okay?
Mm-hmm.
Perfect. So we decided we had some options. We could just drain the abscess, or we could remove the piece of nail too. Because we didn't know exactly what the cause was, I decided that it was going to be more beneficial for both of us to go ahead and remove part of the nail. That helps me to more thoroughly drain the abscess and make sure that it doesn't come back in a few short weeks. As nice as we are, nobody wants to come here over and over. All right, sorry, that was loud. So getting this piece of nail out of there will enable me to clean it out more. And look at that, there's like no purple on there, so I didn't even touch her pedicure. Not that that's the most important thing, but those things aren't cheap. So the roof of this abscess is coming off. It's gonna make it look more gnarly and weird than it should, but that's okay. So we're gonna trim away all of the excess skin in the area that's just flapping in the breeze. And then I use the tool just to make sure that I didn't leave anything behind and that I don't feel any little divots or any sinus tracks, anything that would go anywhere else. So I'm confident this is not going down toward her bone. I'm confident it was just mainly in the skin, and within probably a week, this will be healed. All right, so we're gonna dress it. Katrina is prepared. All right, we're gonna put some ointment on there. I don't really know what I just did then, so we're gonna go with it. These do tend to bleed a lot when we remove the whole toenail. Can I have another gauze? Thank you. Now we're gonna fix it. Most of the time when we take a good section of nail, and especially soft tissue, we have to let it sit for a few minutes. So I'm gonna wrap this one kind of tight. I don't want her walking out of here and leaving a trail of blood behind. And her shoes definitely don't want that either. So we're gonna wrap it up like a little package. I just need this one. And it wouldn't be a Carter procedure if we don't fix it. Look at that, Katrina has me fixed. We put a little cute smiley face on it. And that's gonna help it heal just fine. All right, if you've got a blister or what you think could be a blister on the side of your toe or anywhere else, it could be an abscess, which is infection and is very dangerous. So make sure you get in here and let us look at it. Thanks for watching, guys. Hope you have a good day.